neurology, physiology, and anatomy. This is going to be our sleep physiology video. So the first thing that you have to take into account is that the sleep is regulated by the circadian rhythm, okay? And the circadian rhythm is regulated by the suprachiasmatic nucleus of the hypothalamus. And we're going to talk about the hypothalamus later on, but just know that the suprachiasmatic nucleus of the hypothalamus is very key to sleep physiology, okay? Now, there's two types of stages that you have to take into account. We have non-REM and REM, and REM is just rapid eye movement, okay? Now, what they love to ask about is the different stages and how you know each waveform. So when you're awake with your eyes open, it's beta waveform. When you're awake with your eyes closed, it's alpha waveform. Now, for non-REM, you have stage 1, which is theta waveform. Stage 2 is sleep spindles and K complexes. They like to ask about it. And they also like to ask that you have tooth grinding during stage 2. And then stage non-REM 3 is going to be, or N3, is going to be delta waves. And this is lowest frequency, highest amplitude. And this is where you're going to mainly see sleepwalking, night terrors, and bedwetting occurring during stage N3. And they love to ask about that. And then lastly is our REM sleep, our rapid eye movement sleep. That's going to be a beta waveform. And you're going to have paralysis associated during REM sleep, right? We have loss of motor function during REM sleep. And you're going to have dreaming as well as nightmares occurring in REM sleep. Now, you might ask me, what's the difference between night terrors occurring in stage N3 and REM sleep with nightmares, okay? So keep those two separate. Night terrors are going to be kids who wake up screaming, okay? Unconsolable. They're just freaking out, okay? That's going to be night terror. And when they wake up, they have no memory of it, okay? That's how you know it's night terror. And that's going to be in stage N3. Okay, the difference is our nightmares, which is REM, they're going to be consolable. They're going to be waking up scared, but they're going to be consolable. And then in the morning, they're going to remember that. And that's going to be in REM. Okay, so remember the difference between night terrors occurring in stage N3, non-REM 3, and nightmares occurring in REM sleep. Okay, because they like to ask about it, as well as the EEG forms, the wave forms. They like to ask that as well. For REM sleep, they will ask about the differences in changes in sleep among different populations. But before we talk about it, I want to define something. They always talk about sleep latency. And I never knew what that was because people just assumed you know what that is. I might be dumb, but sleep latency, I'm just going to explain it to you guys real quick. It's just the time needed to fall asleep once you close your eyes. Okay, so if you have an increase in sleep latency, that means by the time you close your eyes to the time you fall asleep, it takes a longer time. Okay, I feel like I have increased sleep latency. But when you have decreased sleep latency, that means you fall asleep like immediately, all right, after closing your eyes. So what happens when you become older? So older adults have an increase in REM latency, okay, meaning that they take longer to get to REM. Okay, so they don't have an increase in sleep latency. They have actually both. They have an increase in sleep latency and they have an increase in REM latency. And that leads to an overall decrease in the amount of time spent in REM, okay? So all in all, remember that they have a decrease in REM cycle total. Okay, so they have less REM than we do as a younger population. Patients that are depressed have a decrease in REM latency, meaning that they get to REM quicker. And that means that they have a increased amount of time spent in REM. Okay. Lastly, in narcolepsy, you have a decrease in REM latency. So that means, once again, you get to REM quicker. Okay, so I hope I didn't rattle you guys with this, but latency just means the time needed to get to that stage. So when you're an older adult, like, very old people, like grandparents, they're going to have a total decrease in the amount of time spent in REM because they have an increase in REM latency and sleep latency. So they take a longer time to get to REM. Whereas people with depression or narcolepsy, they have a total decrease in REM latency. So they get to REM quicker, and so they spend more time in REM. Okay, I hope that makes sense, and that pretty much sums up our sleep physiology video.